Department of Healthcare Services is not giving out questionnaires to their community-based providers to ask them to gather that information from folks, which is historically how things have worked, and they don't get the data. And I can tell you that, like, speaking specifically to skilled nursing facilities, they have a questionnaire that they have to give to every resident on a quarterly basis. And one of the questions in there is, do you have a desire to learn more about moving back into the community or community living options? I would venture to say that 80% of people living in skilled nursing facilities would answer yes to that question, but we don't see that happening. So I think what happens is that they're not doing it when they're being given something, and it's not a priority to check whether it's being done because we have bigger issues happening. We have COVID and we have people dying and we have, there's lots of stuff happening. So I think DHCS has said we want to be intentional. We want this work to happen. We want the providers to tell us how to do it, and then we're going to show up and do it. And I think that that is a proper recipe. And I also think it's really important to note it's not people like me, the administrator, who are making this happen. It's Michael, he's a program director. That's a director level position, but Michael is on the floor every day. He's helping participants go to the restroom. He's helping them walk. He's helping them engage in activities. And he's working with his direct care staff. This is the most critical piece, his direct care staff, to help determine the best way to communicate and work with this population.